it's also called as APS syndrome. What is the meaning of APLA syndrome? Antiphospholipid antibody syndrome. These are the phospholipids are the main component of the major membrane lipids. These are the major membrane lipids, and the antibodies are formed against these phospholipids. So it's called as antiphospholipid antibody syndrome. What are the antibodies are formed against these phospholipids? They are the lupus anticoagulant antibodies, anti-cardiolipin antibodies, and anti-beta 2 glycoprotein antibodies. What these antibodies causes? These antibodies causes thrombosis. What is the meaning of thrombosis? Thrombosis means the formation of clots in the arteries, veins, and the placenta. Due to the formation of thrombosis in the placenta, it causes abortion in the first trimester and second trimester in the pregnancy, and it causes preterm labor, and it also causes the fetal distress. Why it causes the fetal distress? Due to formation of thrombosis in the placenta, there is decrease in the supply of oxygen to the fetus, so it causes fetal distress and also abortion. And to diagnose this APLA syndrome, we have one criteria to diagnose this APLA syndrome. It is called as Sydney or modified Sapporo criteria. In this criteria, to diagnose the APLA syndrome, we need to get one clinical findings and some of the lab findings. So let's know what are the clinical findings and what are the lab findings. The clinical findings to diagnose the APLA syndrome, we should know is there any chances of arterial or venous thrombosis? Is there any history of more than one trimester abortions? It should be less than 10 weeks. If there is history of more than one fetal losses, it should be more than 10 weeks. And we should know what are the history of more than one preterm labor. And what are the lab findings to diagnose the APLA syndrome? These are the lupus anticoagulants. These are the antibodies like anti-cardiolipin antibodies like immunoglobulin G and anti-beta 2 glycoproteins. These are the lab findings. So now let's discuss about the management of APLA syndrome. Actually the cause of APLA syndrome is thrombosis. To remove the clots of in the arteries and veins, we need to remove the clots. We need to get one heparin and aspirin. So we need to give, if there is history of thrombosis or abortion, in case of APLA syndrome, we need to give heparin in the combination of aspirin. Heparin and aspirin, these are the anticoagulants. These are the anticoagulants which remove the clots in the arteries and veins. If there is history of preterm labor and in the pregnant female, if there is no thrombosis and abortion, we should give only the aspirin. In APS syndrome, in non-pregnant females, if there is a history of thrombosis, we should give warfarin. Thank you.